So, welcome to our brand new episode of Lounge with Carlos. And today I've got two very interesting guests who are joining me for the first time. I've got Trevor, who works in substance misuse. His background is mental health, but he's more specialized now in substance misuse. And I also have Huggins, who is a mental health nurse. Between us, we're going to discuss issues around substance misuse and how they affect us in our daily lives, how we can create management structures. Also, we'll look at maybe background behind what causes these problems and to what extent they affect us in our daily lives. So, without wasting any time, I'd like to take this opportunity to invite my two guests. Gentlemen, thanks for joining. It's nice to have you. It's been a long time. We've been planning to do something like this, and it's obviously nice to have you around. To start off with, I want to take a moment just to introduce Trevor first. Trevor, if you can just tell us a little bit about yourself and how you ended up doing substance misuse. Just let people know a little bit about it.
Yeah, thank you, Carlos. Thank you for having me on your platform. So my background, like you mentioned earlier, is in mental health. I trained as a mental health nurse in the early 2000s, and it was whilst I was training as a mental health nurse, was from my upbringing in the far ends of Zimbabwe. I had not really come across substance misuse as such. So it was whilst training as a mental health nurse that I had a very long and interesting placement in detox unit that covered drug detox, alcohol detox. It was then that I just found the whole area quite fascinating and quite close to home because at that time I was just finding my fit with drinking alcohol, and not once was I ever told that it's it's a drug and it's a harmful substance. So I found it fascinating, and the passion just grew from there. And up to now, I'm still practicing in the area.
Nah, that's pretty interesting, man. I think, like you said, back in Zimbabwe, I myself originally from Zimbabwe. It's very interesting how we all used to enjoy that social drink. Never really looked much into it back in the day, but as you get exposed, natural cycle of life, you grow up, you become a bit more mature, you start questioning some of these things that you do, and you start realizing the impacts and implications of some of the things that we do. That's quite interesting. What about you, Huggins? Tell us a little bit more about yourself and your background, mental health.
Thanks, Carlos, for having me on your show. And yeah, just to some extent, both of you as well. I did my nurse training in the UK. Um, I sort of have got about just over 20 years experience in mental health nursing, and moved across to Australia in 2009. So my background has been mainly sort of acute inpatient mental health settings, and here in Australia, sort of worked in mental health rehabilitation, community rehab facilities, not necessarily to do with substance abuse misuse, but just general rehabilitation. And I also do my own private practice as well. And in across all those clinical settings that I've worked within, there's always that common theme of people with histories of substance use, and sort of looking at those things that are affecting them as a result of that. So I think we'll touch on a bit more of those things, and as we go along with the show. But yeah, that's pretty much a basic sort of introduction of myself.
Oh, thank
Thanks.
you very much, Huggins. A combination of these two gentlemen can bring up areas of policy, and management of great interest. So, without wasting time, coming back to you, Trevor, can you describe for us what is actually meant by the term substance misuse?
I can try, yeah. So ideally, I would like to try and break it down between substance and misuse. But the term substance, I'll be getting too much into chemistry, I think, if I try that. But we veered towards the term substance so that we can cover broad area of things that were being misused. Ideally, it was drug misuse. But then we found by saying drug misuse, we're excluding things like alcohol. Because if I say to you right now, alcohol is a drug, you raise your eyebrows and say, oh, is it a drug? Oh, but it's sold in shops. Yeah. Tobacco and other things like that. So the term was drug misuse, but then we thought if we just say substance misuse, then we can include everything in it. The emphasis being on the misuse part. So by misuse, it's using anything in the manner that is not really intended to. In this instance, overusing. So you're looking drinking alcohol in itself in moderation, not an issue. In excess becomes an issue, and that stretches all the way to prescription medication, tobacco, and the list goes on, and we'll get more into that as we go along. So the term substance misuse was sort of brought along so that we can cover a broad spectrum of things that were being misused. If that explains it for you.
Yeah, definitely. That's quite interesting. I suppose it's one of those. It's the small things that we take for granted, isn't it? You think, oh, what harm comes from this? It's just a minor thing. It's not as bad as. We always comfort ourselves by comparison, isn't it? It's not as bad as. Well, at least I'm not doing, weed. I'm not doing cocaine. I'm not doing this drug. It's just a drink. So that's quite interesting. So tell me, Trevor, in your opinion, is there anything that has been found to be a leading cause? And is there any elements of misuse that we can measure to class the extent of use, the kind of extremes that we're looking at when we're talking about substance misuse?
Yeah, causes are quite varied, and it depends on culture, socioeconomic issues. So trauma is one common cause. That could be from either abuse, child abuse, physical abuse, emotional abuse, all sorts of abuses, anything that can cause trauma. Mental health issues, the whole spectrum of mental health issues, from anxiety being the common one, depression, psychosis and schizophrenia. Pain management, sometimes you get prescribed medication for pain management, and at the end of that treatment you feel it's not quite enough, you start sourcing for yourself. Before you know it, you quite like the feeling that the pain medication has been given you. Before you know it, you're buying off the street. So the causes are quite varied and quite individual, but tends to be as a way of self-medicating for something. And that something could be anything across the areas that I've mentioned. Some of it is just recreational that leads to overuse. So when we then say misuse, or when it becomes a problem, is when it starts to control most of your daily routine. I need a drink before I go to work. I'm spending all my money on this particular drug. I'm starting to commit crime to fund this particular habit. So when it becomes something that has control over what you do and how you do things about your daily life, then it becomes an issue of concern. Therefore, the term misuse comes in, because you're not using it for what is intended, or you're overusing it for what is intended. I don't know if that answers your question.
Definitely, it brings a bit more light into the whole term and the concept. Just bringing Huggins into the picture a little bit here. Huggins, from a mental health perspective, how significant is substance misuse? Your frequency of coming across it, and like the problems associated with substance misuse. Just give us a little bit of a breakdown.
Thanks, Carlos. With mental illness and substance use, and I actually quite like how Trevor has summed up a few things there in terms of the the impact around day-to-day functioning. I think that's where we start drawing the line with, just recreational use and when it becomes starting to become a problem when you can't function on your day-to-day things. So, and there's those things here with mental health being its own, having psychological impacts on people's functioning. That's one thing. And then looking at substance use that at times comes as part of that when people sort of use substances to cope. It can start with it's actually an insidious a way that some of these things begin with. People might just be stressed. And you know how it is at times when, you say, let me just have a drink to calm down. Ends up building into sort of some reliance on that. Not only just alcohol, it could be sort of weed. People might just use some weed to chill out. And eventually it starts having an impact on their day-to-day lives. Also, people have different tolerances to substances, and some substances impact people in terms of their mental health. So it can start, causing things like hallucinations, paranoia, depending on the type of drug that's used. So what you tend to find is, there's, different ways that people go into substances as well. It could be peer pressure, like I mentioned, coping with stress. It could be, experimenting with different substances, out of curiosity or something like that. Then, obviously, if someone gets quite reliant on the substances, then it becomes a problem. So, like I highlighted, you've got the things like hallucinations, paranoia, and also the other thing that we tend to see at the tail end or as people advance in life is the long-term impacts of long-term substance use. There's some links or correlations with some elements of cognitive functioning as well. Long-term alcohol use or substance use impacting people's memories or functioning as well. So with mental health, although there's no sort of direct relationship with substance use, there is that prevalence there that is alongside. Most of the times nowadays you get to see, quite a huge number of people turning up into inpatient unit admission wards, for example, or emergency departments at times having people with drug-induced psychosis or paranoia that comes as part of that. So yeah, what you get to see at times is the impact of substances and how it at times induces some of these mental health issues in people.
That's quite interesting. Trevor, tell me, I mean, listening to what Huggins explaining about, some of the challenges that they come across, is there like plans that are in place, in your circles on how to create awareness to these problems and managing them?
Yeah, there are services that are in place. There are plans that are in place, but with like anything else in these geopolitical societies that we live in now, there are always loopholes and there are always deficiencies within the system that we end up not capturing as much people as we should do. There's leaflets in schools, there's leaflets in community halls, there's education programs, there's people, nurses in schools that go and talk to children. There's dual diagnosis services whereby we combine our mental health and drug services so that we can interlink in the way that we work. Um, but like I said, the services are there. They're not fluent, but the services are there, and there's always room for improvement.
That's true. And I mean, from my part, I think, this is one of those things that has driven, this, creation of this kind of platform, for us to talk and address these things. because we take these things for granted. Majority of time we take these things for granted. We look at the worst extremes that we come across in society, in our professions, and we compare ourselves and say, look, at least even though I drink a bit, I'm not as bad as so and so. But we all know that these things have an impact, and like what Huggins saying and sharing regarding people getting admitted with psychosis, even on physical health side. For myself, I work in intensive care, and I have for probably just under 20 years. It's so many times I've come across patients who have got a pretty significant drug and alcohol history. It's a nightmare majority of times to manage, people who've got drug and alcohol history. The ability to medicate them, significantly, use more drug therapies to try and help them cope with whatever treatment you're giving them, and that poses challenges in itself. And even when you're withdrawing somebody from sedation, when they're waking up from ventilators and stuff, it's a nightmare, because you always see that the people who have got a drug or a significant alcohol history always have the hardest time trying to wean off ventilation, trying to recover from an intensive care experience. It's always a nightmare for people. But like I said before, these are things we take for granted. We never think of the other side of life, where we need some kind of physical support, mental health support, and the challenges that our usage of drugs and alcohol has on those experiences. So yeah, I mean, I think, I hope that a program like this reaches people, people who listen, they find themselves in the things that we're talking about, and look for ways of reaching out to people. So I mean, carrying on with you guys based
If I,
Huggins
if
in.
if I can chime in there a bit, Carlos, because you touched on an important point,
Yeah, yeah,
very
feel
interesting
free.
actually, in terms of the medical impact. The medical impact. Um, what I tend to see at times in my private practice is at times people with things like depression that stems from poor pain management, and at times it's built by increased tolerance to substances or painkillers that at times people uh, tend to abuse or overuse over time, and this raises their tolerance for things like pain management medications, for example. So you can have someone that has chronic back pain, has been using a certain type of medication for pain management, and with time they build their tolerance to that medication, and the roundabout manner of how things then go into a cycle where increased pain is causing them more stress. They can't do their normal day-to-day things that they used to do, which then has an impact on their mental state. Can lead to things like depression as well, because of being in constant pain all the time, not being able to whether it's do day-to-day household chores, for example, can be something that's difficult at a baseline, or where someone gets to that point where they are almost bedridden. So, I just thought I'd touch in on that when you mentioned about the medical impact, but also how, over reliance or overuse on things like, pain medication as well, can at times have an impact on overall health, including mental health over time.
Thanks very much for that, Huggins. I mean, Trevor gave us a variation of the things that can lead to substance misuse. I wonder whether we could look more into things like peer pressure. Looking back to how when we were growing up, how we started drinking, what we see in communities, and the challenges that maybe the young ones have as they get introduced to drugs and substances, alcohol. How significant is peer pressure in your view, in terms of substance misuse?
If I could go first, peer pressure is huge, amongst all other contributing factors, but I would attach it to culture and environment in the sense that there are certain abuses of substances that are deemed normal in certain cultures, in certain environments. I would give you an example. It was okay to drink alcohol in excess as long as you had a job and as long as you had a car and as long as you did all your normal roles within the community, it was deemed okay. It wasn't okay if you just got drunk and you didn't work and you didn't do anything else. Then it was a problem. So there was almost a justification of, yeah, you can drink as long as you do this. You can drink as long as you do that. I mean, you see grown men almost comparing notes on how much they could drink. Not once in our education system, growing up, did anybody actually say drinking is bad for you for A, B, C, D, damages your liver, damages your whole cardiovascular system. No one mentioned any of that. Peer pressure, as soon as you could afford to buy something, people were sneaking out, oh, you need to try this, or yes, you need to try that. Same goes with cannabis. It was deemed cool to smoke a joint with your friends. I mean, after school, to be seen to be doing those kind of things. So peer pressure, but as well as cultural influences and the norms of society, depending where you are, in the Western world where I've got my recent experiences, is mainly cigarettes and cannabis that is deemed cool to be smoking at the age of 11, at the age of 12. And depending where you live and poverty lines, it's also deemed okay or cool if your parents are on drugs and your auntie's on drugs, your grandpa was on drugs. It's also deemed okay to have a joint or to have other stimulant and depressant drugs that you shouldn't be even having at that tender age.
And just before Huggins comes in, it's interesting what you're saying about culture, and when we're growing up, as soon as you could afford, you start going to work, you can afford a little bit of this and this. Uh, you somehow have a passport to buy as much drink as you want, and as long as you can tolerate it, nobody asks you any questions. But I think, on a cultural perspective, you are very right, because there were never sit down moments where your uncles and the grown-ups around your circles would sit you down and give you their experiences of the negatives of alcohol. It was very, it was always in passing, but not, you never felt the significance of the sit down talk. And I think maybe from addressing culture, I think that's something that probably we need as adults, as parents, as role models. It's something that we need to start addressing in our family circles, in our friends circles, in our cultures, to start talking to the kids as they reach that age where they start doing the experiments of this and that, and as a role model in the system, or in the family, to start talking to them, and really addressing these things, at a great extent, instead of just leaving them to learn on their own experience. Because we all know, learning is the spectrum for learning is very, is very wide. You leave somebody to learn from their own experience, and before you know it, they've completely damaged the rest of their life before they've even started. So maybe, I think it would be quite interesting to have some of these discussions. Sorry, Huggins, just bringing you back in, mate. You were going to say something there.
Uh, Yes, I know. I think it's an interesting element of culture as well, and impact on that. Not only just peer pressure, but I think, as you all know, in terms of our Zimbabwean culture, um, we don't. It has never been one of those things that's commonplace for adults to sort of present themselves in a vulnerable way at times. We don't open up our emotions as much, or sort of delve deep into what's actually affecting us. We always there's always that sort of view, for example, like my example is mainly sort of targeted towards men or father figures or whatnot. We always want to have that view of everything's fine. I'm in control, and we never sort of had those discussions around things like substance use, how it's affecting someone's day-to-day functioning, and it's around that male ego as well, or just around how our paternal structures were built, where parents are supposed to present in a sort of way, or grown-ups or adults are supposed to present in a certain way, and it didn't allow for people to explain their vulnerabilities. That's one. So that that's one of those things that we, if we became more open with each other about our challenges, things that we face, it would give the younger generation as well a better view of the impacts of just what's classified as normal. Day-to-day drinking, we're just having fun. We are going out. It'll give the paint that other side of things as well. Coming back here to these Western countries, what I've sort of noticed in the sense of peer pressure now, it'd be interesting to actually Google what the term peer pressure means, because what happens as well, from my observation, is at times with our kids growing up in these Western worlds, um, uh, there's that element of isolation as well. And I know, Carlos, we often talk about building a community for our kids, and so they know that they are not on their own. They've got people around them. But say for that, in terms of areas like going to school, fitting into the community, at times you might find people feeling compelled to delve into some behaviors to fit in as such, and be part and parcel of what's deemed to be cool or normal within that environment. So at times that then leads people down these substance misuse paths, whether it's alcohol or whether it's trying a joint here and there, or using something else as well, as a way of trying to fit in. So those are some of the things that I've noticed that have an impact on this seems to be like a self-perpetuating cycle as well of at times people falling into substance use.
Thanks very much for that. A very interesting, analysis here. With obviously Huggins being in Australia and Trevor being in England, are there any similarities in the approaches of managing substance misuse? In terms of awareness, what levels are you addressing substance misuse? Are you going into schools? Are you going into communities? What kind of approaches do you find out there?
If I could go first, I'm not quite familiar. Maybe Huggins will shed some light, but I'm not quite familiar with how Australia um, addresses the whole substance misuse field. I know there's a lot of similarities. Here in the UK, the programs have been around for a long time. So the outreach services are there from primary schools, secondary, GP surgeries, any health outlet. There's always a leaflet to call somebody. There's phone numbers being advertised on TV. There's treatment programs that are quite easily accessible, and those are available in all sorts of settings, in mental health settings, in community settings, in prisons. So the program itself is quite widespread and easily accessible. effectiveness of it, I think that will be another hour or 2 hours of another discussion to
True.
be had.
Yeah, but that insight is quite it's quite good. I'll let Huggins tell us his version. Carry on, Huggins.
Yeah, I think there are similarities between sort of how substance use is sort of addressed or managed or targeted here in Australia and in the UK. We've got similar services as well, I'd say, Trevor, to you guys, from across both spectrums from, child and adolescent to sort of adult and older persons as well. I think you mentioned there about correctional facilities as well. There are drug and alcohol support services as well here as that. So I'd say the approach across Australia and the UK would be similar. Here in Victoria, which is the state that we live in, there's a huge drive on youth mental health and trying to sort of have that early intervention aspect of things to, help provide as much information and support as possible to young people to hopefully get in early to prevent, possible issues that will come up as a result of substance use.
So basically, with what you've just said there, what I'm finding is that there is very strong, significant support structures addressing this problem. Like Trevor said, the effect and results from it, it's a whole different topic in itself. But the important thing is that the problem has been recognized, and there are systems in place to support people and reach out for people. There's support structures that Huggins has highlighted, starting from very young ages, community awareness and stuff. Now, that leads me to my next point. When we look at, developing countries and, the rise of, new substances, illicit drugs, increase in alcohol intake, trying to battle poverty and all these challenges, where do we go in terms of setting up structures? Do you have contact with people, say back home in Zimbabwe? Do you know people with the similar kind of work cycle, work systems, substance misuse? Is there any structures there that help people?
I'm not sure. I'm confident there are. Whether they're quite nationwide and widespread, I'm not sure. In terms of contacts, I don't have any. I would love to because it's my area of interest. It's an area I feel I could contribute to, especially in Zimbabwe. In terms of addressing it, like many things, for me, education is key. Educate, educate, educate. I remember when there was an outbreak of other physical health diseases like HIV and AIDS. I mean, we were absolutely bombarded with information and education in schools, in clinics, everywhere you went. There was a flyer, there was a poster. I'm sure those sort of services are emerging or they are already there. So all I can say is if there are there, I would quite like to link up with them, help spread the word that it can reach all four corners.
I'm not quite familiar with the systems, for example, in Zimbabwe, in terms of how they are working, but I think things around awareness are important and making sure that there is access to information about the impacts of substance misuse. And like I'm sure all of you, in terms of some videos we tend to see on YouTube or something like that, there are documentaries that talk about the impacts of substance use in Zimbabwe, and I think there's a lot of work to be done there. Obviously, looking at things like resourcing, service availability, and there are a lot of factors that affect this issue of substance use, in developing countries, but more so in Zimbabwe. So, like Trevor, if there are services that are out there that are providing the support, it'll be good to be aware and see how we can help as well. To sort of educate people as well in terms of the impacts this has on their mental health, their physical health, their overall well-being.
It's very interesting when you look at the rise of things like crystal meth. I've seen several documentaries for the rampant cases of addiction to crystal meth and some other illicit drugs. I think homing in on the things that you guys have talked about, it's very important to create that community awareness, getting people talking about these things, and and taking people away from this element of suffering in silence, but actually sharing these things within communities, within systems, because sometimes it's the common man who suffers. And I think it's probably in our best interests within our communities, within our circles, to educate one another, to create that community awareness within ourselves, to create some of these structures. They don't need funding as such, but you can go a long way by having discussions within families, within communities, within circles. But the important thing is people need to start talking about this. People need to start moving away from the concept of suffering in silence and fear of being judged and ridiculed and stuff, because at the end of the day, if you don't talk about it, you don't get the help. If you don't talk about it, nobody knows the structures that need to be developed for people to get support, because no one is talking about it. So for people to get the structures, for people to get the support, it's my view, my opinion, that people need to talk about these things and create that cycle of developing structures, that cycle of supporting one another, for getting the community back to being a unit of support that once upon a time we grew up under. People used to support each other, people used to care about what's going on with your neighbor, not because you were nosy, but you wanted to live with a healthy neighbor next to you because it was good for your family as well, good for your kids. You end up being isolated because your kids can't play next door, because the kids next door do certain things. Your kids can't play the other side. But if we start creating these avenues where people talk, people share, people support each other, I think it helps to make the world, the communities, a better place. So I'm really grateful for you guys, taking this time to share your experiences, your ideas, your opinions of this issue of substance misuse. Just to round off, Trevor, is there anything that you would like, any parting words, anything you'd like to share as we come to a conclusion of our program?
Absolutely. For me, the key in any societies, and for example, third world countries, that as much as there is a culture, we need to start understanding and questioning things and educating those around us, mainly our kids. They learn most of the things from us, from schools, from other community leaders. If we are all saying this is a drug, this is what it does to you, this is how you can avoid it. Open the conversation, have that channel open so that your kid can actually feel free to come to you and say, grandpa, grandma, dad, this has been offered to me. What is it? Those kind of conversations, because the youth, a lot of parents are worried that, oh, he didn't come home till 8 o'clock at night. Where was he? They're having to learn off other people, and those experiences are often quite negative. Those are the conversations that you can sit around at the table and openly discuss the negative impacts of it, what it does to your body, what it does to your brain, what it does to everything about you, what it does to your lifestyle. Open the conversations and don't judge others just because Carlos next door's son has done this, therefore the whole community avoids it. Open the conversation, have a word with them, discuss, educate each other. Would be my parting words on that part.
Yeah, thanks very much, Trevor. Huggins, what's your parting words? Any thoughts, advice to the general public?
I think I agree with Trevor. I think the more we open up or destigmatize some of these topics is where we start getting some headway. You know, let's talk about it, and people feeling comfortable to open up or approach. You know, whether it's adults or people that they can discuss with about their substance use, or if they've been offered something, and not feel judged or sort of segregated as a result of whether it's using substances or questioning or being curious about using substances. So, having that opening up the communication channels around, substance use, demystifying it, at times removing the stigma, helps people to actually come up and be able to talk about substance use and talk about it open and honestly as well. I think when we start doing that, raising awareness, people will become more educated around, the negatives. And also there are positives to substance use as well. If I may add, as much as controversial that might be, there's a reason why people use substances, but it's then giving people that overall view, so they know the impacts of long-term or ongoing substance use as well. So education and an awareness, and let's talk about it.
So, look, guys, the reason for this program is for people to share, for people to educate one another. I look forward to more of these topics, more of these discussions, more, thought-provoking discussions of the things that we take for granted every day. Like I said before, all the guys who've been discussing here are sharing opinions based on their professional experiences. These are not opinions that represent the organizations that they or we work for, but these are our opinions as professionals. So I look forward to reading comments. Subscribe to the channel. If anybody out there has got something they want to share from a mental health perspective, a physical health perspective, whether you're a patient, whether you're a carer, whether you're a parent, whether you are a clinician, this is the place where you want to be. This is the place where you want to discuss things that matter the most in people's lives. This is Lounge with Carlos. Thank you for watching.